Good day, everyone. I'm Amaobong Bassey, speaker for In-Stride Pathways Youth Foundation, and I'll be speaking on health literacy and career opportunities in global health. This is a lecture for the annual 30-day Career Boost Initiative for African Youth, pioneered by the In-Stride Pathways Youth Foundation. Health literacy is basically the ability to obtain, understand, and use information to make informed health choices. So the whole point of health literacy is to know enough to make informed decisions about your health. Now, according to the U.S. Department of Health and Human Services, it's known as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Now, health literacy encompasses a lot of skills. Various skills include reading, comprehension, and critical thinking in order to navigate the healthcare system, to manage your personal health and prevent diseases. Now, we're in an era where you could get information quite easily, and to be honest, it's as dangerous as it is helpful, because you can get information that is not beneficial to you. You can get the wrong information. Same where rumors are being spread, wrong information about health is equally spread that way. So you need to know the proper source, the right source for your information. Now, being health literate will help to make decisions. Provides enhanced decision making, improved health outcomes, because if you know more about your health, you manage your chronic conditions and you manage them better, and you also have better preventive care. So studies have shown that individuals with higher health literacy levels experience better health outcomes and lower mortality rates. So this is an example by Beckman et al. In 2011. Now, health literacy will also lead to reduction in healthcare costs, because it will prevent costly emergency care through better management of health. Now, I'm going to use an example. Right, let's say I recently saw a tweet where someone said, if you do not spend little now to manage your health, you will spend more later. So what came into perspective was, let me cite an example. Say you notice some irritation with your eye, you notice, maybe you see things blurrily, you see you have blood images, blood visions rather, and rather than get your eye checked, you delay, and it eventually becomes something else. So if you had gotten your eye checked initially, maybe what you would have ended up with would be maybe corrective glasses. But because you had wasted time, you couldn't make an informed decision. You were not aware of what was really happening. You didn't have enough information on that. You now delayed, and eventually it became something that would require eye surgery. Yeah, that's not pleasant. So that's where health literacy comes in, to reduce healthcare costs. I'll move to global health. Global health is the health of populations in a worldwide context. So the same way we have international health, we have public health, which could be restricted to certain populations. Global health is all-encompassing. It's an area of study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. So now, problems that transcend national borders or have global political and economic impacts are often emphasized. So it's worldwide health improvement. Yeah, that's what global health is all about. It encompasses a lot of many fields, including healthcare, science, politics, economics, and sociology. So careers in global health leverage on knowledge and skills in policy development, international relations, and communications. So these are a list of some available global health career specializations. We have cancer, which is where I'm concerned with. We have child health, disease prevention and control, global health advocacy, global health innovations, global health nutrition, health leadership, health policy, HIV and AIDS. HIV and AIDS is actually more, there's spotlight on HIV and AIDS in Africa, right? Epidemics and pandemics, maternal and newborn care, mental health, sexual and reproductive health, tuberculosis, and vaccinations. Now, these are frequently asked questions when it comes to career opportunities in global health. People ask, do they need to be doctors to do global health? The answer is no. You do not need to have a medical certificate. You don't need to be a doctor, a nurse, pharmacist. There's a range of professionals, professions in global health. Do you need a degree in health field? I just explained that. No. Do I need a degree in global health? No. To start, no, you do not. But eventually you will have to get further acquainted, get further degrees. You need a master's in public health, which is more relevant than master's in global health. Now, MPH is more established. Do you need to be an academic to do global health? No. Do you need a job at WHO to do global health? No. And do you have to move to an LMIC, a low middle income country, to do global health? No. But the truth is, as in most African countries are low to middle income countries, so that's already an advantage for you. So down the line, I'll talk about skills and competencies that are valued in global health. Now, these are categories of career paths in global health. Now, healthcare delivery and management, research and academia, policy and advocacy, public health practice, non-profit and humanitarian work. Now, these categories are kind of intertwined, so you might have a professional in one category also being in another category. For example, public health practice, you will have those in healthcare delivery and management also being part of public health practice, even those in research and academia and non-profits and humanitarian work. So they are basically intertwined. So for healthcare delivery and management, these roles involve providing medical care and managing healthcare systems. So the professionals here, they work to improve healthcare systems, and professionals you'll find in this category include the doctors, surgeons, nurses, pharmacists, physiotherapists, healthcare administrators. And the professionals are not limited to what I just mentioned, right? We have a lot more. And organizations and employers you'd find for those in this exercising this role, you have the WHO, the Centers for Disease Control and Prevention, UNICEF, non-governmental organizations, ministries of health, and also private healthcare companies, the hospitals and the likes. For research and academia, they focus on studying health issues and developing solutions. So we have a prominent public health concern, global health concern. Those in research and academia will go forward into studying the problem and trying to find solutions to them. Like we had in the COVID case, I think I'll use that example a lot here. We had in the COVID case, we had research scientists doing a lot of things, trying to find ways to save lives and the like. So here we have epidemiologists, biostatisticians, and scientists generally. So a biostatistician uses numbers, right, to answer pressing questions in public health and medicine. to use statistical analysis. So they might research what causes cancer. They might find out if a new prescription drug works. They can find out how harmful certain chemicals are for the body, or how long a pandemic will last using numbers, right? They can make such predictions. And they design clinical trials and they evaluate drug or patient outcomes. Now, epidemiologists investigate patterns and causes of diseases, injuries, and disorders in society. They try to reduce their occurrence and risk through research, education, and health policy. So you might find them in government, in private sector, with health insurance, or pharmaceutical companies, or in non-profit organizations. So they typically specialize in areas such as maternal health, infectious diseases, environmental health, genetics, emergency response, and mental health. So policy and advocacy, these roles involve influencing health policies and promoting health equity. So the focus on influencing health decisions. So these are people that make policies, these are people that make policies. They decide for this is what we're going for, and that sticks, right? They champion causes to improve health outcomes. So they stamp their foot down, and those in advocacy, they make us aware of situations at hand, what to do to prevent these things. So like I mentioned earlier, that we have different professions in global health. The economics, sociologists, this is where they all fall in. So the skills at work here: tactfulness, good communication, critical thinking, analytical thinking, good understanding of processes and political systems, and the ability to maneuver, because you're going to be doing a lot of international relations, right? And you need to understand the policies of certain countries, the politics of certain areas, and how to work around it. So here we have policy analysts, advocacy managers, public affairs specialists. We have global health advocates, health policy advisors, campaign directors, and community engagement coordinators. So for public health practice, like I said earlier, we'd have most of these categories have intertwined career opportunities. So basically what they do in public health is they implement health programs and interventions, right? They make use of the policies that have been made, and they use that to implement the solutions, the interventions to the problems we have. So here we have the epidemiologists. I had explained what they do earlier: health educators, program managers, environmental health specialists. And these organizations are where you most likely find them: government agencies and NGOs, that's the non-governmental organizations. And the non-profit and humanitarian work, they basically provide aid and support in crisis situations. We find most of them in the northern region, right? Because that's in Nigeria. We find most of them in northern region, providing relief and support. So program managers oversee humanitarian aid programs and ensure effective response. Fundraising and development professionals secure resources for the humanitarian work. We have those in communication and advocacy who raise awareness and mobilize support. Then we have the field workers who provide direct aid and support in crisis situations. So some of the people we have in some organizations we have that do this. We have the Doctors Without Borders, right? So we have a lot. We actually have a lot of non-profits and humanitarian work going on in Africa. In Africa. So there's a lot to be done with that. The skills and qualifications. So to work in the global health space, you need to have some essential skills: cultural competence, understand the culture of different regions, right? language proficiency, adaptability and flexibility, strong communication and teamwork skills, strategy and project design, project management. And for the qualifications, so while your degree is enough to get you through the door, to move higher you will have to get more certifications, you will have to get more qualifications, a master's in public health, a PhD, and the like, then different certifications. So I didn't mention supply chain, which is also it's also part of career opportunities you find in global health. So how to get started, right? Network. Basically, in every aspect of life, to move forward you need to network. We have a lot of people who, while they're in school, they prefer to just focus on your books. While focusing on your books is really good, right, you also need to spread your tentacles, get involved in things, network, meet people, attend global health conferences and events. This is where you get more information about things, policy making, right? Join global health organizations and associations and try to volunteer, right? Most non-profit organizations and NGOs, they take in volunteers. In short, that's how most people get into the global health space. They go in as volunteers. They volunteer to provide help, and along the line they get adopted into the system. So it's easier for the experience you get can be really useful, because most times in global health experience is really important. So participate in global health projects and internships, apply for internships, right? So being from a low middle income country is an advantage when it comes to global health. It is a serious advantage. So you get the opportunities to apply for internship globally, even regionally as well. You gain practical experience in global health settings. You can get this through the internships you apply for, right? You can get this through the internships you apply for fellowships, pursue global health fellowships, develop expertise in global health areas, and you also take up continuing education and professional development. Stay updated on global health issues and trends, develop new skills and knowledge. Like I said, we're in an era where information is easily accessible, right? There's a way you key into Google and every day you get updated with trends in global health, trends in internships, global internship, even fellowships and the likes. We have some for Africans and we have some globally, basically. So these are basically the types of organizations we have in the global health space. So the non-governmental organizations, NGOs, Save the Children, Save the Child, Care, Partners in Health, that's PSI, FHI 360, MSH, that's MSH, PAD, CiAY, Resolve. Now, I know in Nigeria we have Save the Child, we have FHI, of which ECUS falls under that. MSH is in Nigeria. PSI, yes, is also in Nigeria. Then delivery of humanitarian services, we have the Doctors Without Borders, International Rescue Corps, the Red Cross, Site Savers, Operation Smile, bilateral organizations and government agencies, see the USAID, Global Affairs in Canada, CIDA, Public Health Agency of Canada, and multilateral organizations and UN agencies, the United Nations, WHO, World Food Programs, UNICEF. Then this is okay. So we have consulting firms, McKinsey, BCG, Deloitte. Now these consulting firms sometimes offer internship, so most of them are basically into policy making, right? They're basically into policy making as well. For foundations, we have Bill and Melinda Gates Foundation, Rockefeller, the Merck Foundation, the FIN, and the Geneva. Policy and advocacy organizations, we have Results for Development Institute, Stop TB Partnership, Center for Global Development. And in the academia, we have Johns Hopkins University, London School of Hygiene and Tropical Medicine, University of Hong Kong. So these universities can also offer scholarship opportunities, for you to expand your reach. And you can also get certified courses from Coursera, Udemy. We have there's so many resources available to you. So these are my references, and thank you very much for joining and listening in. If you have any questions, feel free to reach out. Yes, feel free to reach out. The Insight Pathways Youth Foundation, they do have my details, and they can relay your questions. Thank you.